Ontario Regulation Module: Prescribing, Dispensing, Compounding, Selling, Administering by Injection or Inhalation. The purpose of this presentation is to provide Ontario NDs with an overview of the drugs that they can prescribe, dispense, compound, sell, and administer by injection or inhalation under the general regulation. NDs in Ontario who have met the standard of practice for prescribing can provide a patient with a prescription for any of the drugs listed in Table 3 of the General Regulation. The prescription allows a patient to access that drug either through a pharmacy or through the ND's dispensary. In some limited cases, an ND may write a prescription for a drug in order to be able to obtain that drug for resale from their dispensary or for in-office administration, that is, emergency drugs. Prescribing drugs and recommending NHPs. An ND in Ontario who has met the standard of practice for prescribing can provide a patient a prescription for any of the drugs listed in Table 3 of the General Regulation. The prescription allows the patient to access that drug either through a pharmacy or through the ND's dispensary. Where a drug is not listed in Table 3 of the regulation, for example, Ativan, it is because NDs are not authorized to prescribe that drug to patients. Where a substance is not listed in Table 3, example, vitamin C, it is because it is a natural health product and is available without a prescription. Where a patient is expected to take a substance, that is, as part of their treatment plan, which is not listed in Table 3 due to it being a natural health product, NHP, a prescription is not required. In this instance, the ND is recommending the substance as opposed to prescribing it. It is the responsibility of the ND to know when a prescription is required. Relevant standards of practice. Section 9(2) of the General Regulation outlines the standard of practice that applies when an ND is going to prescribe a drug on Table 3. These general requirements include, but are not limited to, the ND having a naturopath-patient relationship with the individual receiving the prescription, the drug being prescribed for therapeutic purposes only, and the ND notifying the other primary health care providers of the prescription unless the patient does not consent to the notification. Another relevant standard appears in Section 9(3) of the regulation. This standard details the information that must appear on the prescription and includes name and address of the patient, name, strength, and quantity of the drug prescribed, and directions for use, etc. Finally, Section 9(4) of the General Regulation outlines the record-keeping requirements for an ND who is writing a prescription for a patient. NDs who intend to prescribe the drugs on Table 3 are required to review, be familiar with, and operate within these sections of the regulation. Table 3. Its limitations and intricacies. Table 3 lists the drug an ND can prescribe and the specifics around drug limitations, routes of administration, and dosages. The limitations, routes of administration, and dosages provide NDs with information about limits on the amount of the drug that can be prescribed, or circumstances about when a substance is considered a drug, that is, due to the route of administration, specific treatment indication, or dosage amount. For example, podophyllum is a drug on Table 3, and in order to prescribe it to a patient, a prescription is always necessary. There are no limitations on the dosage, so dosage amounts are left to the knowledge, skill, and judgment of the registrant. On the other hand, Digitalis purpurea and its glycosides is also a drug on Table 3, also requires a prescription whenever it is being prescribed to a patient, but also carries a limitation that an ND must monitor the patient's serum level. If a registrant will not or cannot monitor the serum levels, they may not prescribe this drug. Folic acid and vitamin A are two examples of where the limitations outline when a substance becomes a drug due to dosage amounts. Folic acid under 1 mg per dose, or where the total dosage per day is less than 1 mg, is not a drug and does not require a prescription. The moment the ND increases the dosage or daily dosage above 1 mg, folic acid becomes a drug and a prescription is required. The same applies to vitamin A with a dosage or daily dosage of 10,000 IU. Professional practice scenarios: prescribing versus administering. Scenario 1. A patient consults with a naturopathic doctor and has been determined through blood laboratory testing to be vitamin D deficient. To correct this deficiency, a dosage of vitamin D that is greater than 25,000 IU is determined by the ND as required. As the recommended dosage meets the limitations stipulated in the prescription drug list as of February 2021, for classification of a drug, you must write a prescription for the patient and inform them that the prescription may be filled at a pharmacy or via your dispensary, if available. The appropriate guidelines for prescription sales are outlined in Section 12 of the General Regulation. Scenario 2. A patient arrives at your office and begins to experience chest pain. Although the patient experiences angina regularly, they have forgotten to bring along their nitroglycerine patches. If you have met the prescribing standards of practice, you may prescribe sublingual dosages of nitroglycerine to the patient in order to administer it from your emergency kit if needed. However, you cannot dispense more for the patient to take home after the conclusion of the patient's visit. If you have not met the standards of practice for prescribing, the appropriate measure would be to call emergency services. A call to emergency services would be appropriate in either case if the symptoms did not alleviate. Dispensing a drug. What is dispensing? Dispensing is a controlled act when an ND dispenses a drug that is listed in Table 4 of the General Regulation. Where a drug is not listed in Table 4 of the regulation, for example Ativan, it is because NDs are not authorized to dispense that drug to patients. Where a substance is not listed in Table 4, for example vitamin C, it is because it is a natural health product that is available without a prescription. In such instances, an ND may provide that substance to their patient, but are not legally dispensing it. The General Regulation makes an important distinction between dispensing or handing out of the drug and administering a drug, which is not handed out per se, but is given to a patient in office by inhalation or injection. Relevant standards of practice. There are a number of relevant standards of practice in the General Regulation that pertain to the Control Act of Dispensing. Section 10(2) of the regulation establishes the primary standards of practice that a registrant must follow when dispensing. These include, but are not limited to, unless the exception outlined in Section 10.3 applies, the ND having a naturopath-patient relationship with the person to whom they are dispensing the drug, or the drug being dispensed for therapeutic purposes, and the ND advising the patient or their authorized representative that the drug may be available in a pharmacy. The ND must comply with any of the limitations, route of administration, or dosage information that appears in Table 4. Standards of practice relating to labeling of a dispensed drug appear under paragraph 11 of Section 10.2 of the regulation and include the ND's name and title, the name, address, and telephone number of the place from which the drug is dispensed, the identification of the drug, its name, strength, and manufacturer, and the quantity of the drug, etc. NDs who intend to dispense the drugs on Table 4 are required to review, be familiar with, and operate within these sections of the regulation. Dispensing a drug to non-patients. Subsection 10.3 is unique to the naturopathic profession. It allows an ND to dispense a drug to a person who is not a patient, provided the following conditions are met. The ND has the prescription for the drug in their possession. The prescription is from another ND and not from any other regulated health professional. The prescription contains all of the necessary information required under the prescribing provisions of the regulation, and the ND retains a copy of the prescription in their records. Table 4. Its limitations and intricacies. Table 4 lists the drugs an ND can dispense and the limitations, routes of administration, and dosages that apply. The limitations, routes of administration, and dosages will provide NDs with information about limits on the amount of a drug that can be dispensed, information about a substance being a drug only when dispensed over certain dosages, or circumstances about when a substance being dispensed is considered a drug. Table 4 is very similar to Table 3 in this regard. However, there are several substances that appear on Table 3 of prescribing that do not appear on Table 4 of dispensing, because they allow an ND to access the drug for use, but do not allow the ND to dispense the drug. For example, calcium gluconate must be prescribed if being administered in an injectable form. However, as it is being administered in office by the ND, the substance would not be dispensed and therefore does not appear on Table 4. Dispensing. Professional practice scenario 1. Following a patient checkup, you determine that your patient requires 175 mg of vitamin K2, which needs to be prescribed. You inform the patient that they may have the prescription filled at your clinic dispensary or at a local pharmacy. The patient opts to purchase the prescription from you. In dispensing this substance, you must ensure that the product labels contain all of the dispensing information requirements outlined in Section 10.2 of the General Regulation, that a copy of this information is put into the patient's file, and that the dosage instructions are reviewed with the patient. Dispensing. Professional practice scenario number 2. A patient of another ND is on vacation in your city and forgot to bring their bioidentical estrogen and progesterone creams with them. The patient inquires whether it is possible to purchase a refill of their prescriptions from your office for their month away from home. As the dispensing ND, you are expected to contact the patient's primary ND and obtain a new prescription for the patient. Once obtained, you would then be able to dispense the required prescription from your office, making sure that all required labeling information is included and that a copy of this information is retained on file at your office. Selling a drug. What is selling a drug? Selling a drug is a controlled act when an ND sells a drug that is listed in Table 6 of the General Regulation. Where a drug is not listed in Table 6 of the regulation, for example, Ativan, it is because NDs are not authorized to sell that drug to patients. Where a substance is not listed in Table 6, for example, vitamin C, it is because it is a natural health product that is available without a prescription, and an ND may provide that substance to their patient. While a patient may purchase a publicly available product, or NHP, from an ND, the controlled act of selling a drug applies only to the substances listed on Table 6. Relevant standards of practice. There are a number of relevant standards of practice in the General Regulation that pertain to the controlled act of selling a drug. The standards of practice for selling a drug may be found in Section 12(2) of the regulation. Examples of the standards include: unless subsection 12(3) applies, an ND must have a naturopath-patient relationship with the person for whom the drug is sold and must only sell a drug to the patient or their authorized representative. The drug must be sold only for therapeutic purposes. The drug must be sold in accordance with any limitations set out in Table 6. And the ND must not sell the drug for a profit or where they receive a direct or indirect personal or financial benefit. NDs who intend to sell the drugs on Table 6 are required to review, be familiar with, and operate within these sections of the regulation. Selling to non-patients. Subsection 12(3) is unique to the naturopathic profession. It allows an ND to sell a drug to a person who is not a patient, provided certain conditions apply. These conditions are: the ND has the prescription for the drug in their possession, the prescription is from another ND and not from any other regulated health professional, the prescription contains all of the necessary information required under the prescribing provisions of the regulation, and the ND retains a copy of the prescription in their records. Table 6. Its limitations and intricacies. Table 6 lists the drugs an ND can sell and the limitations, routes of administration, and dosages that apply. The limitations, routes of administration, and dosages provide NDs with information about limits on the amount of drug that can be sold, information about a substance being a drug only when sold over certain dosages, or circumstances about when a substance being sold is a drug. Table 6 is very similar to Table 3 in this regard. However, there are several substances that appear on Table 3 of prescribing that do not appear on Table 6 of selling. For example, in an emergency, an ND may prescribe nitroglycerine. However, because the circumstances are emergency, a registrant may not sell the drug. As mentioned in previous examples highlighting nitroglycerine and salbutamol, these substances are within the scope of an ND who has met the standards of prescribing to use with their patients in an emergency situation in clinic, but they may not be sold to patients. This would require a referral to a medical doctor for a prescription or a prescription refill. Nitroglycerin. It is allowed for emergency use only. It is on the prescribing table to allow an ND to purchase from a pharmacist for in-office use or to keep in their crash cart. It is not on table 4, drugs that may be dispensed, as an ND cannot dispense the drug to a patient to take home, but would use it only in an emergency situation in clinic. It is not on table 5, drugs that may be compounded, as it may not be compounded. It is not on table 6, drugs that may be sold, as even when given in an emergency, it is not expected that an ND would charge a fee for providing it to the patient. Selling. Professional practice scenario. You prescribe a patient a dose of vitamin A at over 10,000 IU QD for 1 month, and the patient elects to purchase it from your dispensary rather than a pharmacy. In selling this product, what should the cost reflect? The cost of the drug only, or the cost of the drug plus an additional fee to recover costs associated with running your dispensary? If the prescribed vitamin A is sold to the patient from your dispensary, it is expected that the patient is charged only the cost of the drug. NDs may not sell a drug if the selling provides a profit. Compounding a drug. What is compounding a drug? Compounding a drug is a controlled act when an ND reconstitutes, dilutes, mixes, prepares, or labels 2 or more drugs listed in Table 5 of the General Regulation to create a customized therapeutic product for the patient. Where a drug is not listed in Table 5 to the regulation, example Ativan, it is because NDs are not authorized to compound that drug for patients. Where a substance is not listed in Table 5, for example vitamin C, it is because it is a natural health product that is available without a prescription, and an ND may reconstitute, dilute, mix, prepare, or label 1 or more of these substances without the process being considered a controlled act. However, the ND must still comply with the college's standard of practice for compounding, example labeling requirements. An ND compounds in a number of circumstances, including compounding drugs for the purposes of prescribing, dispensing, and selling the customized therapeutic product, for example, a mixed botanical tincture. Compounding drugs for the purposes of administering the customized therapeutic product to a patient by inhalation, for example, 0.9% saline and glutathione compounded for nebulizing, or compounding drugs for the purposes of administering the customized therapeutic product to a patient by injection, for example, vitamin B12 and folic acid IM injection, and compounding drugs for the purposes of administering the customized therapeutic product to a patient by intravenous infusion therapy, IVIT, example multivitamin and mineral nutritional IV treatment. The premises where an ND compounds for IVIT is subject to inspection under the college's inspection program, Part 4 of the General Regulation. Whenever a drug is reconstituted, diluted, mixed with another drug or substances, it is compounding. For example, an ND who mixes a drug, example dextrose, with saline solution for the purposes of IVIT, they are compounding under the General Regulation. Compounding a drug. Relevant standards of practice. Section 11.2 of the General Regulation establishes the standards of practice for compounding, which include, but are not limited to, the following. The ND having a naturopath-patient relationship with the person for whom the drug is compounded. The ND must have the knowledge, skill, and judgment to compound the drug safely, competently, and ethically. The ND must compound the drug in accordance with any limitations that appear in Table 5. And the ND may only compound a drug when a supply of a Health Canada approved, commercially available, prepared product that meets the patient's needs is not reasonably available. Paragraph 12 of Section 11.2 outlines the standards of practice for labeling a compounded drug. These requirements include, among other requirements, the ND's name and title, the name, address, and telephone number of the location where the drug was compounded, and the percentage of each of the drugs or substances and other ingredients used to make the compounded product and the quantity of the compounding product in the container. NDs who intend to compound the drugs on Table 5 need to review, be familiar with, and operate within these sections of the regulation, as well as the college's standards of practice for compounding if intending to mix natural health products. Table 5. Its limitations and intricacies. Table 5 lists the drugs an ND can compound and the limitations, routes of administration, and dosages that apply. The limitations, routes of administration, and dosages provide NDs with information about limits on the amount of drug that can be compounded, information about a substance being a drug only when compounded over a certain dosage, or circumstances about when a substance being compounded is a drug. Table 5 is very similar to Tables 3, 4, and 6. Adenosine triphosphate is considered a drug if being compounded for IVIT. If the substance was being mixed for oral use, the controlled act of compounding would not apply. However, the college's standards of practice for compounding would still need to be adhered to. Rauwolfia may be compounded with other herbs to be prescribed and sold to a patient for oral use. However, it cannot be compounded for either inhalation or injection therapies as it does not appear on Tables 1 or 2. Compounding, professional practice scenario. A patient arrives for a follow-up visit to assess the effect of the cardiovascular tincture of general scope botanicals that you provided to them at a previous visit. After consult and physical exam, you decide that Rauwolfia would be a beneficial addition to the patient's tincture. Does the addition of Rauwolfia make this a controlled act? Yes. In adding Rauwolfia, you must have met the standards of practice for prescribing to be able to prescribe this botanical, as it is classified as a drug. The patient must also continue to be monitored and assessed for response to treatment, both positive and for any adverse effects. Administering a prescribed substance by inhalation. What is administering a drug by inhalation? Although the RHPA includes a controlled act of administering a substance by inhalation, the act itself does not define what that is. The role of interpreting what constitutes inhalation is left up to the various health regulatory colleges whose members are authorized to perform this controlled act. The college has interpreted this controlled act in the case of naturopathic practice to mean the administration of a substance using a mask, nasal cannula, or aerosol inhaler. Any substance that a patient breathes in by any other means is not interpreted to mean the controlled act of administering by inhalation. Example, breathing in essential oils. An ND may administer by inhalation, that is, by means of a mask, nasal cannula, or aerosol inhaler, only those substances listed in Table 1 of the General Regulation. Relevant standards of practice. Section 5.2 of the General Regulation sets out the standards of practice for administration of a substance by both inhalation and injection. It notes that if an ND mixes, prepares, packages, or labels two or more substances in Tables 1 or 2 for the purposes of administering a customized therapeutic product, they do so in compliance with all the standards for compounding as set out in the regulation. The standards of practice set out in Section 3.1 of the regulation apply to this controlled act. These general requirements include, but are not limited to, the ND having a naturopath-patient relationship and having recorded the patient's health history, informing the patient before performing the controlled act of the purpose of the controlled act, the risks inherent in its performance, and alternative treatments the ND knows or ought to know are available, receiving informed consent, and ensuring that appropriate infection control procedures are in place and that the controlled act is performed in a clean, safe, private, and comfortable environment. Table 1. Its limitations and intricacies. Tables 1 and 2 are significantly different than Tables 3, 4, 5, and 6, where Tables 3 through 6 inclusively list the drugs that may be prescribed, dispensed, compounded, or sold. Tables 1 and 2 are the prescribed substances that may be administered by inhalation and injection. This distinction means that an ND can only administer by inhalation a substance listed on Table 1. Table 1 lists only 5 substances. 2 are for use in an emergency situation only: ipratropium bromide and salbutamol, therapeutic oxygen, saline, usually when compounded with another substance for administration by inhalation, acetylcysteine or glutathione. No other substances may be administered by inhalation. It is important to note that therapeutic oxygen does not appear on Table 3, drugs that may be prescribed. Therefore, while an ND may administer it in office, they may not provide a patient with a prescription for the use of oxygen in their home. Administering by inhalation. Professional practice scenario. A patient presents at your office with a chronic chest infection and difficulty expectorating mucus. The patient has been prescribed an antibiotic, and after examining them, you decide to recommend that they undergo a few nebulized glutathione treatments to support their lungs and facilitate mucus clearance. The patient inquires if it would be okay to steam vaporize some eucalyptus essential oil when they return home from your office, which you confirm would be fine. Which part of the patient's visit involves the controlled act of administering by inhalation? The recommendation to a patient to access nebulized glutathione can be made by any actively practicing registered naturopathic doctor. However, administering the glutathione treatment is restricted to NDs who have met the standard of practice for prescribing. The recommendation to vaporize essential oils does not fall within the controlled act of administering by inhalation and does not require the ND to have met the standard of practice for prescribing. What is administering by injection? Administration of a substance by injection is the controlled act of injecting a substance by an intramuscular injection, subcutaneous injection, or by intravenous infusion. An ND may only inject a substance that is listed on Table 2 of the General Regulation, subject to the route of administration and any limitations outlined on the table. For example, sodium iodide may only be administered by intravenous infusion and in combination with other minerals. Under Canadian and Ontario law, once a substance is administered below the dermis, it becomes a drug. Example, saline solution once injected is a drug and as a result has been listed on Table 2. NDs who intend to administer a substance by injection, Table 2, need to review, be familiar with, and operate within these sections of the regulation. In addition to the standard of practice for prescribing, NDs who wish to administer a substance intravenously must also meet the standard of practice for intravenous infusion therapy, or IVIT. Administering by injection. Practice scenario number 1. You consult with a patient who has been recently diagnosed with celiac disease. They have also been found to be deficient in vitamin B12 by their medical doctor. You explain to the patient that their best option for quick repletion would be an IM injection of vitamin B12, but you have not met the standard practice of prescribing. What can you do in this instance to allow your patient to obtain the IM injection of B12? A referral may be made to a naturopathic colleague who has met the standard of practice for prescribing to administer the vitamin B12 IM. Adhering to the information noted in the college's referrals and consultations guidelines document. Table 2. Its limitations and intricacies. Similar to Table 1, Table 2 prescribes the substances that an ND may administer by injection, including by IVIT. If the substance an ND wishes to inject is not on the list, then the ND may not inject that substance. Table 2 lists the substances that an ND can inject, the route of administration, and the limitations and dosages that apply. The limitations, routes of administration, and dosages will provide NDs with information about the route or routes of administration by which the substance may be injected, information about limits on the amount of drug that can be injected, and information about combinations of substances that may be necessary. Some minerals, such as vanadium, must only be administered with other minerals and not as a singular vitamin. The dosage amounts, however, are left up to the knowledge, skill, and judgment of the ND. Other limitations include specifics regarding technique. For example, ferrous sulfate must be administered by Z-track only, and specifics regarding indication for use. For example, emergency-only substances. Please refer to Table 2 of the General Regulation for the limitations and specifics with respect to prescribed substances that may be administered by injection. Administering by injection. Practice scenario number 2. A long-standing hypertensive patient returns to your office for assistance as they have recently experienced a small elevation in their blood pressure. Their cardiologist has recommended supportive treatment, but the patient has requested to consult with you for a second opinion. Since their blood pressure elevation is mild and they are in robust health, you suggest they have a series of nutritional IVs to replete some vitamins and minerals known to support optimal heart function and then reassess their blood pressure. Alongside potassium chloride and magnesium sulfate, you determined that glutamine would be beneficial. What considerations need to be made with respect to administering these substances by IV? The patient must consent to the treatment and to having you notify their cardiologist of the treatment plan. You must then notify the cardiologist and follow up with a treatment update in an appropriate length of time. Additionally, as glutamine has a limitation that it cannot be administered as a singular amino acid, it must be administered in combination with other amino acids. Finally, if the patient did not respond to treatment within a reasonable amount of time, a recommendation that they schedule an appointment with their cardiologist would be an appropriate course of action. What is a natural health product and when might it be a drug? The Natural Health Products Regulation and the Schedule 1 attached to it identify that a natural health product NHP substance is 1. A plant or plant material, an algae, a bacterium, a fungus, or a non-human animal material. 2. An extract or isolate of the substances identified in the preceding bullet point. 3. Any vitamins, biotin, folate, niacin, pantothenic acid, riboflavin, thiamine, A, B6, B12, C, D, E, K1, K2. Number 4, an amino acid. 5, an essential fatty acid. 6, a synthetic duplicate of a substance in bullets 2 to 5. 7, a mineral. Or 8, a probiotic. Typically, an NHP is not considered a drug. However, there are certain unique circumstances when an NHP becomes a drug, including but not necessarily limited to when the NHP is injected below the dermis. Example, vitamin B12 injection. When the NHP is listed on the prescription drug list from Health Canada. For example, vitamin A over 10,000 IUs or vitamin D over 2,500 IUs. When the NHP is a controlled drug or substance under the Controlled Drugs and Substances Act, for example, homeopathic cannabis. When the NHP is designed in the regulations made under the Drugs and Pharmacies Regulation Act as a drug. For NDs, it may not always be safe to assume that because a product is a natural health product, it is available for recommendation to patients. An ND must be certain that the product has not been designated as a drug under statute and if it is, that it is authorized for use under the general regulation. Links and resources used to make this presentation include Corno's website, the general regulation, e-laws, prescription drug list, NAPRA, Drugs and Pharmacies Regulation Act, and Controlled Drugs and Substances Act.